If you're struggling with your complexion and you're wondering which acne treatment to go with after you've seen the numerous ads on television for all the different products that are available, well, we've got someone here to help you out, maybe help you understand the products, what's best for you, what may work, what may not. Dr. Sarah Sawyer, she's a Birmingham dermatologist. Thank you for coming in.
Thank you, Tiffany.
Okay, well, first of all, if somebody is buying a product over the counter, what are some of the key ingredients they need to think about and look for on the box when they're purchasing something?
Well, most of the products have one of two active ingredients, either salicylic acid or benzoyl peroxide. If you have comedonal acne, so if you have blackheads and whiteheads, you need to look for higher percentages of salicylic acid. If you have pink bumps, which is your typical, what we call inflammatory acne, like the pink zits, that's going to be more of a benzoyl peroxide job.
Okay. So
that's just a generality. The salicylic acids usually come in anywhere from 0.5 to 2%. 2% is the legal limit on over-the-counter products. Benzoyl peroxides usually come between 2.5% and 10%.
All right, we have a number of products in the studio. We want you to kind of walk us through and tell us, you know, what each product is best for treating, I guess. So let's start with Clearasil.
That is a kit, and it has actually both types. It has some salicylic acid products and one benzoyl peroxide product. So based on the type of acne that you have, you may not use everything in the kit, but most of the kits will have a combination of both. So if you have drier skin, you need to look for the lower percentages, so the salicylic acid 0.5 and the benzoyl peroxide 2.5. But the Clearasil products have both. That's the proactive, and we all have heard that.
All the different celebrities are endorsing this. So when your thoughts on this product?
I think it's good. I think for anybody that is having just some mild acne, really any of these systems are going to work pretty well. And the over-the-counter products actually work quite well for comedonal acne. Sometimes the inflammatory problem needs to be seen by a dermatologist, and lots of times we prescribe oral antibiotics for that.
Okay. All right, moving right along, I believe this is Clinique.
Clinique, they have a little bit more salicylic acid, so that's going to be more for the comedonal acne. But I actually did a trial on one of my office staff, and she said it made her skin a little bit dry. And it's important not to let your skin get too dry, because then your skin produces more oil, which is the opposite of what you like.
Okay, we're almost out of time, so let's kind of scan through these. Clean and Clear is the next product.
This has more benzoyl peroxide. It has 10% benzoyl peroxide, which can cause a lot of dryness, but still same two products that we're dealing with.
Okay, the ZO Skin Health.
ZO Skin Health has 2% salicylic acid. It comes on like an astringent.
Okay, and it works well. Let's see, this one is Velocity.
I actually could not find an active ingredient in these, so these are going to be very gentle, not going to dry the skin out, and probably for very mild acne.
Okay, and Thermaclear.
Thermaclear is very similar to the Xeno device, and it actually heats up the bacteria in order to kill the bacteria that causes acne. You hold it on the skin. Is it a safe device to use at home? It's very safe. You hold it on for about 2 seconds, and if you do that 2 or 3 times a day, it can help speed the resolution of a pimple. Okay,
but I guess if you try these over-the-counter products, common sense would tell you, and they're not really working, you need to see, you know, a professional, right? You need to see a dermatologist like yourself. All right, well, Sarah Sawyer, thank you very much for coming in. We appreciate it.
Thanks for having me.
If you'd like more information about all of these products, you can go to our website, myfoxal.com. We will also have a link to Dr. Sawyer's website on ours as well.